To invite Mr. Basel Mousslly to talk about, he works for Refugee Services of Texas, and he's going to share some of his experiences.
Hi everyone. Thank you so much for inviting us. It's a great opportunity to share with you. My name is Basel. I work for Refugee Services of Texas, one of 5 resettlement agencies here in Houston. Refugee Services of Texas, it's a non-profit, 501c3. We are located in 5 cities in Texas: Houston, Austin, Fort Worth, Amarillo, and Dallas. I'm lucky to work in Houston. Houston is a very welcoming city. Houston have resettled the most refugees in 2016 compared to any other city here in the nation. So also with who is a refugee? A refugee is a person who didn't choose to leave his country. He was forced to leave the country, and this is due being prosecuted based on religion, based on race, political opinion, and just simply a membership in particular social group. So who we serve? Our agency, we serve refugees, asylees, people who have a special immigrant visa, and unaccompanied children. I would like to talk about the differences between those groups. So a refugee is the person who left his country to a neighboring country, basically usually in border. They just cross the border to a neighboring country and get registered through UNHCR, or if it's not available, they go to the American embassy. So a refugee will wait for his resettlement for years. Sometimes it goes up to 7 years in the camps. During this time, the refugee UNHCR qualified refugees to be resettled. Once a refugee get the refugee status, they will be traveling to the U.S. and here where our team go to the airport, meet the family, take them to their homes, and provide services. An asylee is the person who is already here in the U.S. and asks for asylum, and he will be considered asylum seeker until his case is approved. Once it's approved, it's going to be considered he will be considered asylee, and there where our services also start. Special immigrant visa, it's given to people who used to work with the U.S. Army or contractors overseas in Afghanistan or Iraq. Those people, because they've been working with the U.S. Army, their lives got endangered, their lives and their families. So the U.S. give them a visa to travel to the U.S. It's a special immigrant visa, and once they arrive in here, they will be considered as refugees as well. And of course, there's the unoccupied children. Dr. Marsh has talked about it. It's the children who just cross the border and they will be detained in those horrible detention centers. Once they identify a relative who is here, can host this child, a relative or a friend or a caregiver. So once the child moves out from the detention center to those homes, our agency step up and provide case management services. Our clients are very diverse. Languages, I can say over 15. I'm pretty sure it's more. Our staff actually in our agency speaks about 50 languages. The most countries that we resettle refugees, you can say we have from Democratic Republic of Congo, Afghanistan, Iraq, Syria, Burma. There's many other countries. Of course, their diversity is very unique. They come into the U.S. with a lot of skills. There's a lot of people with university degrees in different areas, like in IT, in healthcare, nurses. Even they have other skills like dancing and cooking. And you guys can see the restaurants here in Houston. The diversity is just, I like it a lot. So refugee health. Basically, every refugee family arrived to the U.S. They've been screened. They were in health screening before they even get to put their foot in the plane and come to the U.S. After arrival, after they arrive to the U.S., there's a lot of other health screening that we provide. We refer them to refugee. It's a Harris County refugee clinic. Where they get to be screened and they get vaccinations as needed. Also, what we do is we do a lot of orientations, medical orientations, where we try to educate clients about their health condition and how to access healthcare here in the U.S. And we know the health system is just so complicated. Refugee healthcare. So basically, all the refugees family, when they arrive to the U.S., they are qualified to apply for Medicaid as any other American. There's also refugee medical assistance that's given to the people for up to 8 months. I'll talk about it. And of course, they can apply to the Harris Health Financial Assistance, where they can get some other assistance. So the refugee medical assistance, right now it's a company called Point Comfort Underwriters. So if you ever heard about this company is a health insurance company that provide it's a health insurance that clients can access to go to doctors, pharmacies, and they can. It's for 8 months. Any refugee family, they are if they don't qualify to receive Medicaid, they will get the refugee medical assistance for up to 8 months. We're talking about the day of arrival. The clock starts right the day of arrival. This insurance provides also transportation and interpretation, which helps a lot of our families. As I mentioned, they are very diverse. They are enrolled in English classes, but it takes them a while until they start to understand English and communicate in English. So interpretation is a very critical need for our families. As a case manager, we do educate a lot. We sit with clients and we educate them about the U.S. life, about how to access different stuff. I mean, for a refugee family, everything is kind of new to them. Even going to Walmart, sometimes it's kind of overwhelming. Like, they're used to measure by kilogram, by kilometer. Here it's like pound and foot, miles. So basically, those small details, we might not think about it, right? It's obvious, but it is something new a family needs to know when they arrive to the U.S. We also like how to use the metro system in Houston, how to, and of course, like if they have a health condition, we educate them. If someone is diabetic, how to maintain his health. And as case managers, we also try to help them to arrange for their medical treatment. Not like just to make sure they get to go to their appointments. How to book their appointments. How we know there's a lot of challenges. I'll talk about those challenges. There's a lot of resources here in Houston, but connecting the right people to those resources, that's a case manager can assist with. Advocacy, of course, that's why we're also here. Challenges, there's all those always. Yeah. So basically, language is the main challenge. Our clients, they're very diverse. It takes them a while until they start to speak in English and communicate in English. So once when a family have a medical need, they will call to their doctor to have an appointment. Not all clinics speaks 15 languages, so language is a very hard issue. I know during the actual service, when the doctor sees the patient, sometimes there is interpretation over the phone or so, but until to get to that point, it's a lot of struggle for a refugee family when they arrive. Insurance, so basically Medicaid, Point Comfort, even like I've been here in America more than 4 years, it's really hard to deal with health insurance. So if you can imagine for someone just arrived and he would like to take his child to the doctor and then end up, for example, for any emergency, went to an ER, end up with a lot of bills that he is insured, but those bills someone needs to take care of it and contacting the insurance. And connecting it to language, here you can see how hard it is to deal with transportation. So even that we do assist clients with transportation as case managers, it's always an issue. Clients, our families, they don't have cars, especially once they just arrive. As I mentioned, accessing the window of use in transportation, going over up to appointments if someone is really sick and have to go 3 buses to reach out to his appointment. The good part about the insurance, the Medicaid or Point Comfort, they provide transportation. But as I meant, like if you connect it to language also, how to speak to Medicaid until you arrange for a taxi to take you to your appointment, and just simply the driver wasn't caring enough and just didn't show up to his appointments. Those appointments need to be rescheduled, and it takes a very, very long time and hard. I mean, our families, they really struggle until they get this. Also, like for insurance, let's say it's 8 months until the client gets to be seen by a physician, and then for any other reason, he couldn't show up for the appointment for transportation reasons, let's say, those appointments will have to be rescheduled, and the insurance, the period will approach to end, the health insurance approach to end. So we really try to advocate for medical providers to take in consideration this issue for our clients. Education. So, as our clients are very diverse, some of them have university degrees, others they used to work in farms or in different places. So basically, as case managers, we always try to educate them about the importance of accessing health care. We know it's overwhelming at the beginning to take the step to go to doctors and so on. They need to be educated about their condition also. Some of them have health conditions that really they don't know how to take care of it. They know, for example, a person is diabetic, but he doesn't know what type of food is good for him or not. So there's a lot of at the clinics, at the hospitals, they do give those education classes usually. But as case managers, our role to connect them to those resources and make sure the client understands where he can get help needed. So this is actually, I like this picture. Those are a group of volunteers. Right after, I'm pretty sure you guys heard about executive orders, no more refugees, and so on. And this is something still up to date. We open to see the news, what's going on. This is a group of volunteers after the executive orders came out, and then the executive order got halted by a federal judge. And then we had a family coming in. So we got actually people from everywhere coming out to the airport to welcome the family. And that's a group of welcome team. It's a huge group actually, because they all wanted to make sure that the family, when they come to the US, are welcomed. And people here in Houston would like to see them here succeeding and continue their lives in an appropriate way. So that's also a great thing to be in Houston. Thank you all. I know there's an agenda about question and answer, so I'll have to wait. So thank you so much.